ever wondered why your disability claim might have been denied despite having medical treatment? It's a question that can cause many sleepless nights, and today we're here to shed some light on this often misunderstood area. You see, when it comes to evaluating disability claims, the Social Security Administration, or SSA, doesn't simply look at the fact that you're undergoing treatment. Instead, they delve deeper, assessing the course of your treatment. This means they're interested in the consistent, ongoing medical care you're receiving, rather than isolated events or treatments. A common misconception is that prescribed medication alone is enough to demonstrate a disability. However, this isn't typically the case. For instance, taking mental health medication alone usually won't result in a successful mental health claim. Rather, a successful course of treatment in such a case would often include regular visits to a psychiatrist, perhaps once a month, and a therapist, perhaps once a week. It's not just about seeing a specialist, it's about how often you're seeing them. If your psychiatrist only wants to see you every 3 months, or you're seeing a therapist once a month, this might indicate a mild course of treatment, which may not be deemed as evidence of disability by the SSA. Similarly, if you're only receiving pain medications from a primary care doctor or only seeing an orthopedic doctor once or twice a year, this again indicates a mild course of treatment. A more serious course of treatment would include prescribed use of aids like a cane, walker, brace, physical therapy, or TENS unit, regular visits to the orthopedic doctor, and consultations with a neurologist. Moreover, seeing non-medical doctors alone, such as a chiropractor, can signal to the SSA that the condition isn't very serious. But seeing a chiropractor in addition to regular visits at pain management could be a sufficient level of treatment. So in essence, think of your treatment in terms of a course of treatment, rather than ticking off a list of doctors you've seen once or twice. Frequent visits to specialists, coupled with medication and other forms of treatment, can lead to a finding of disability. Always ask yourself, does the treatment I'm receiving sound serious enough for someone to find me disabled? Remember, it's not just about having a disability, but how it's treated that matters. Let's delve into the concept of course of treatment and why it's crucial for your disability claim. When we talk about a course of treatment, we're not referring to isolated medical events or a single prescription. Rather, it's a comprehensive and ongoing plan involving various forms of therapy, medication, and regular visits to medical specialists. Take a mental health claim, for instance. It's not enough to just take prescribed medication. A successful claim typically involves seeing a psychiatrist once a month and a therapist once a week. It's not just about the medication, but also about the frequency and consistency of your visits to these specialists. The importance of this cannot be overstated. Regular visits to specialists paint a clearer picture of your condition and its impact on your life. If a psychiatrist only wants to see you every 3 months, or you're seeing a therapist once a month, this might indicate a milder course of treatment. Such a mild course is less likely to result in a finding of disability. It's not just about seeing a specialist, but how often you're seeing them. For example, if you're only receiving pain medications from a primary care doctor or seeing an orthopedic doctor once or twice a year, this could be seen as a mild course of treatment. A more serious treatment plan might include a cane, walker, or brace, regular physical therapy, the use of a TENS unit, monthly or quarterly visits to an orthopedic doctor, and also seeing a neurologist. Moreover, relying solely on non-medical doctors could suggest to the Social Security Administration that your condition is not very serious. Seeing a chiropractor alone may not be enough, but combining chiropractic treatment with regular visits to pain management could create a sufficient level of treatment. So when it comes to treatment, think in terms of a comprehensive course, not just checking off doctors that you've seen once or twice. Frequent visits to specialists, combined with medication and other forms of treatment, can lead to a finding of disability. And finally, ask yourself, does the treatment I am receiving sound serious enough for someone to find me disabled? A comprehensive course of treatment is a vital piece of the puzzle in a successful disability claim. So what differentiates a mild course of treatment from a serious one? Let's delve into it. Imagine 2 people with orthopedic conditions. The first one receives pain medication from a primary care doctor and sees an orthopedic specialist once or twice a year. This is what we call a mild course of treatment. It's not that this treatment is ineffective, but it's not comprehensive enough to convince the Social Security Administration, or SSA, of the severity of the disability. The second person, on the other hand, is prescribed not just pain medication, but also assistive devices like a cane, walker, or brace. They undergo physical therapy, use a TENS unit for pain management, and see an orthopedic specialist every month or every 3 months. Additionally, they also have regular appointments with a neurologist. This is what we refer to as a serious course of treatment. It's an all-encompassing approach that addresses the condition from multiple angles, signaling to the SSA that the disability is indeed severe. Now let's talk about non-medical doctors. If you're only seeing a chiropractor, for instance, the SSA may interpret that as a sign that your condition isn't very serious. But if you're seeing a chiropractor in addition to making regular visits to a pain management specialist, it contributes to the overall seriousness of your treatment course. In essence, it's not just about checking off doctors that you've seen once or twice. It's about demonstrating a consistent and comprehensive approach to managing your condition. The frequency of your visits to specialists, the range of treatments you're undergoing, and the inclusion of non-medical doctors in your treatment plan all contribute to painting a picture of a serious course of treatment. So when you're considering your treatment plan, ask yourself, does the treatment I'm receiving sound serious enough for someone to find me disabled? Remember, common sense goes a long way. A serious course of treatment that includes regular visits to specialists and additional treatments could be key to winning your disability claim. Let's revisit what we've discussed so far. We've journeyed through the complex world of Social Security disability claims, and we've underscored how crucial it is to view treatment as a comprehensive course rather than isolated events. The Social Security Administration isn't just looking for prescribed medication, they're looking for a complete picture of your health journey. Let's take mental health, for example. Simply taking medication alone doesn't paint a full picture of disability. A robust course of treatment includes regular visits to a psychiatrist, perhaps once a month, and a therapist, maybe once a week. It's not just about seeing a specialist, but also about how frequently you're seeing them. A once every 3 months visit to a psychiatrist or a monthly visit to a therapist might suggest a milder course of treatment, which may not lead to a finding of disability. The same principle applies to physical health. If you're only receiving pain medications from a primary care doctor, or if you're only seeing an orthopedic doctor once or twice a year, this indicates a mild course of treatment. A more serious course of treatment might involve the prescription of mobility aids like a cane, walker, or brace, regular physical therapy, the use of a TENS unit, monthly or quarterly visits to an orthopedic doctor, and consultations with a neurologist. Remember, non-medical professionals alone won't suffice. Seeing a chiropractor alone won't cut it, but regular visits to a chiropractor, in addition to consistent appointments at a pain management clinic, could indicate a sufficient level of treatment. So as we wrap up, remember to think of treatment as a course, not a checklist of doctors you've seen once or twice. Frequent visits to specialists, along with medication and other forms of treatment, can lead to a finding of disability. Ask yourself, does the treatment that I'm receiving sound serious enough for someone to find me disabled? Remember, common sense goes a long way in your disability claim.